Members, good morning. We have a quorum. I call to order the special meeting of the Finance Committee. Starting from today, the Finance Committee will hold 21 sessions of special meetings over 8 sittings for 5 consecutive days to examine the 2026-27 estimates of expenditure. The purpose of examining the estimates is to ensure that the provision sought is no more than it is necessary for the execution of the approved policies. Before each session, I will first ask the secretaries of the relevant bureaus to speak. Members may then raise their questions. Prior to the meetings, members submitted a total of 3,700 written questions on the estimates. The government has undertaken to provide written supplies to about 3,300 questions in order before the corresponding sessions of these special meetings. I remind members that all questions must be directly related to the estimates of expenditure. Before asking the questions, members please quote the reply serial number at the top right-hand corner of the written reply, such as HHB 001. If members cannot follow up on the written replies provided by the administration during the meeting, supplementary written questions can be submitted, but the scope should be limited to following up on the written replies of the administration. Members can submit your supplementary questions in a standard form to the Secretariat by 7 p.m. today. The form was emailed to members on the 8th of April. The administration will strive to provide replies before the third meeting on the budget, which will be conducted on the 29th of April. Session number 1, Health. From 9 a.m. to 10:50 p.m. Let's welcome Professor Low, Secretary for Health, and his team to the meeting today. I will first ask Professor Low to say a few words, and then members can ask questions. Please press the button if you want to ask questions. Secretary, Professor Low, please. Chairman, members, good morning. In 2026-27, the estimated recurrent expenditure on healthcare is $118.9 billion, up 4% from the 2025-26 revised estimate, and accounting for 19.8% of recurrent government expenditure. In 2026-27, the government provides the Hospital Authority with $101.8 billion in recurrent subvention, up 2.8% from 2025-26 revised estimate of $99 billion to meet projected demand growth. The HA's major new initiatives include 1. Implementing the fees and charges reform for public health care and strengthening protection for the 4 categories of patients, that is the poor, acute, serious, and critical. 2. Improving the quantity and quality of public healthcare services, including adding about 200 hospital beds and shortening specialist outpatient waiting times. 3. Setting up stroke centers and chest pain centers. And 4. Continuing to develop smart wards, smart clinics, and smart pharmacies. As regards private healthcare regulation, we will submit regulations to the Legislative Council this year to enhance price transparency. On developing an international health and medical innovation hub in line with national direction under the 15th Five-Year Plan to support the development of innovative drugs and medical devices, the government is committed to reforming Hong Kong's drug and medical device approval and regulatory system, promoting clinical trials, and developing Hong Kong into an international health and medical innovation hub. We started implementing the first phase of the new drug registration mechanism for primary evaluation in March 2026. In the second half of this year, we will introduce a bill to the Council on establishing the Hong Kong Center for Medical Products Regulation to set up center by the end of this year. We will also submit legislative proposals on medical device regulation. The GBA Clinical Trial Collaboration Platform, co-established by Hong Kong and Shenzhen, has already been launched to support and promote more research and development activities by pharmaceutical companies in Hong Kong and the GBA. The International Clinical Trial Academy will be set up in 2027, and the Real World Study and Application Center will build the GBA Real World Data Platform to promote the standardization of clinical data in the GBA. Hong Kong is facing a shortfall of healthcare professionals and overall, especially in the public healthcare sector. The government has been strengthening local training and opening up new pathways for non-locally trained healthcare professionals. Regarding the third medical school, we support the Hong Kong University Science and Technology in setting up the third medical school. We have set aside land and resources for the development of the new medical school campus. Our target is to admit the first cohort of 50 students in the 28 to 29 academic year. Last month, the government launched the Primary Healthcare Co-Care Network. Its first 5-year target is about 700,000 participants. In addition to the current screening and management of the 3 highs and hepatitis B, it will progressively cover more chronic diseases. The use of drugs on the community drug formulary will be rolled out in an orderly manner in the second half of the year. The community pharmacy program will also be launched in the fourth quarter across all 18 districts in Hong Kong. The government will extend the elderly healthcare voucher pilot reward scheme to the end of 2028, involving an additional expenditure of $1 billion. Elderly persons who use $1,000 or more in the healthcare vouchers in the same year for designated primary healthcare purposes will receive a $500 reward, and the total amount of vouchers they receive that year will increase from $2,000 to $2,500. The government is committed to promoting the development of Chinese medicine in Hong Kong in order to develop Hong Kong into a bridgehead for the internationalization of Chinese medicine. The 2 flagship institutions, namely the Chinese Medicine Hospital of Hong Kong and the permanent premises of the Government Chinese Medicine Testing Institute, have started services in phases. The government will take forward in an orderly manner the policy measures set out in the Chinese Medicine Development Blueprint. The government has long been strengthening tobacco control through a multi-pronged approach and a progressive approach. Preliminary data show that Hong Kong's smoking rate fell from 9.1% in 2023 to 8.5% in 2025. We'll continue with the measures in this regard. Lastly, the government will continue to implement the 5-year eHealth Plus plan to build an integrated healthcare information infrastructure that combines data sharing, service delivery, and care journey management. That concludes my introduction. My colleagues and I are happy to answer members' questions. So far, 18 members have pressed the button to request to speak. Let me first read out their name so the members can prepare. Ms. Christine Fong, Ms. Rebecca Chen, Mr. Chen Pui Leung, Reverend Peter Kun, Dominic Lee, Cheng Hock Fong, Professor Chen Wen Kong, Bill Tang, Dr. David Lam, Ms. Zhou Chen, Perry Yu, Chen Pui Kong, Stanley Ng, Chen Pak Chi, Kwok Fu Yong, Tam Chen Kwok, Lau Ka Kang, Hong Kam In, a total of 18 members. In order to let more members speak, let's keep ourselves to 4 minutes each, questions and answers included. Ms. Christine Fong, please. Thank you, Chairman. Thank you, Secretary, for coming over to our meeting. We have seen an increase of 19.8% of recurrent government expenditure, up 4% from the revised estimate last year, and the estimated recurrent expenditure on healthcare is $118.9 billion. Ms. Christine Fong, please cite the reply serial number. Well, I'd like to speak on the script of the Secretary. I'd like to ask about the amount of $118.9 billion, up 2.8%. I'd like to ask about Children's Hospital in Kowloon East. I'd like to ask about the scale or the ratio. Just now you talked about the ratio in relation to the third medical school at the Hong Kong UST as well. So I'd like to ask about the ratio in this regard. How much does it make up? Regarding international cybersecurity, can you tell us the amount? Secretary, do you have any reply? I will try, but I'm afraid I will have to ask Dr. Libby Lee to provide information. It might be the first time for some members to take part in special meetings of the Finance Committee. Members need to pinpoint the reply serial number provided by the administration before they will provide replies. Regarding overall policy directions, it is not within the scope of the discussion today. All right, Secretary, I believe Ms. Christine Fong asked about the percentage of the Kowloon East cluster. I will ask Dr. Libby Lee to provide information in this regard. Thank you. Thank you, Ms. Fong, for her questions. We don't just take into account the population in Kowloon East. The figures fluctuate from year to year. In some hospitals in Kowloon East, some will be commissioned, whereas some will be moved. So we cannot take into account one single year. That will not reflect the real situation. For the real situation or the real figures, I'm going to provide supplementary figures after the meeting. Dr. Libby Lee? Well, in the past few years, we have been developing hospitals in the Kowloon East cluster. That's why I'd like to know the actual growth. Dr. Lee will provide written replies after the meeting. Professor Low? Well, Ms. Fong is asking us about a figure that wasn't mentioned in our reply, so we need to check our information before getting back to a member. Thank you. Ms. Rebecca Chen, HHB 019. Thank you. I'd like to ask about attendances over the long holidays. At present, the government is implementing charges and fees reform. We are concerned about evening and holiday sessions. Are there any relevant sessions for the public in 2024 Easter holiday? Western medicine, a total of 132 clinics or attendances. There are far more Western medicine clinics than the Chinese medicine counterparts. Will the administration consider making better use of the Chinese medicine in order to provide better services? As we can see, comparing 2025 and 2024, there was a marked decrease. What are the reasons for this? In the same reply serial number, I'd like to ask about the number of practitioners listed in the primary care directory. The number is 4,056. That is the latest figure we have. Are there fewer private doctors? We have the target of 700,000 people. If only 1,936 doctors are participating in one of the scheme, whereas for the CCDC pilot scheme, the number of doctors is 770. So how are you going to encourage more doctors to take part in these schemes? You have the target of the number of patients. So in the coming 5 years, how many doctors do you require to take part in this network? I'd like to ask about 015 and 017. 3,500 nurses shortfall, about 10% of the shortfall. The number of part-time nurses has seen a plunge. From 2023 to 24, the number was 2,970 to the latest figure of 1,392. Is it possible to increase the number of nurses? A lot of frontline nurses have related to us that there is a shortfall in frontline nurses. There's a lack of nurses in medical wards as well. I'd like to ask my colleague, Dr. Pang, to take your questions. Thank you. Regarding the provision of primary healthcare services, the hospital authority provide 13 evening clinics for members of the public to seek medical attention. They are mainly for episodic diseases. And for private hospitals, they have one hospital providing round-the-clock services for episodic diseases. We have integrated Chinese and Western medicine services. Well, we do partner with different Western medicine services so the members of the public can look for doctors online. We have uploaded the related information online so the members of the public can find the relevant information online. They do want to increase the number of clinical sessions over holidays. Thank you.
Ms. Chan, since the 4-minute time limit is up, perhaps you should follow up on the question in writing. Next, Mr. Chen Pui-Leung. Please just ask 1 or 2 questions. Mr. Chen Pui-Leung. I want to ask reply serial number 201. In the reply, it is said that 12.2% of vaccines procured had to be destroyed. So, as far as the dollar sign is concerned, we're talking about $23 million for the $93 million of vaccines procured. So, in future procurement exercises, is there a way to control the expenditure so as to minimize loss? The next question is about serial number 35, and according to the reply, about the voluntary health insurance scheme, the premium on average is $8,000 is the figure in 2019. However, because of the escalating premium in recent years, I'd like to know on what basis you have proposed a tax deduction amount of $8,000. Will you consider adjusting the amount? For the first question, I will ask Dr. Ronald Lam, the Director of Health, to take that question about disposal of vaccines. Now, as far as procurement is concerned, we adopt a evidence-based approach. We have a scientific committee on vaccination. They consider, for example, the relevant epidemics, the procurement situation, as well as the overall community prevention strategy. After the scientific committee has given us the recommendation, we'll also calculate the amount to be procured based on the population size. Now, there were difficulties back then because of the emergence of new variants and strains of the vaccines. They happened quite rapidly. So, despite having the WHO's recommendations on procurement, new vaccines had to be procured to cope with new strains, and there was a time gap. There was also a global procurement exercise by WHO. We made a comparison in relation to procurement and mutation of the strains. Because of the changes, we had to compare our stock with the COVAX stock kept by the WHO. I'd say that the trend is the same. About VHIS, especially on effectiveness. In fact, after COVID-19, over 1.4 million policies have been taken out, so that's been an increase. In taking forward the development of VHIS, we have to review its effectiveness. There is an apparent increase in the number of policyholders, but we also need to gauge the effectiveness, especially its benefits on the overall healthcare system. During the 3-year COVID-19 pandemic, there were major implications. So we are reviewing the situation and see whether the mode of subsidy would change in future. Any follow-up, Mr. Chen Pui-Leung? For vaccines that are soon to be expired, will you consider widening the scope so that those persons originally not eligible will be able to use the vaccines? Just a yes or no answer, please. Secretary. Regarding the vaccination subsidy program, we based our strategy on the recommendations made by the scientific committee. Our target is on high-risk groups. Now, for vaccines that are soon going to be expired, we're approaching the end of an epidemic, so it won't be effective. Reverend Peter Kuhn, my question is on 224 about the two items in the annex. For tackle, $86 million of subsidy were received, and then some $27 million for COSH. Why is it that for COSH, such a big sum has been handed out? Is there any duplication? Can we consolidate the resources? Because it seems we have achieved quite a good result on smoking cessation. Some are really stubborn smokers. Can we consolidate the resources? COSH is an important member of our team in combating smoking. It complements the work of the Department of Health. We also rely on COSH in our tobacco control strategy. On smoking cessation services, I'll give the floor to the Director of Health. Thank you. Now, on tobacco control, smoking cessation is a major strategy. And as the Secretary mentioned, the smoking prevalence rate has further lowered to 8.5%, so that's really a success. Now, we work closely with the COSH. It is a statutory organization. We have a clear division of work. The Department of Health is primarily responsible on managing the smoking cessation hotline. So that's the first line of defense. And second, we also offer subsidies to various NGOs such as Tongwa Groups of Hospitals, Pok Oi, the Christian Family Services, and other universities. They put in place smoking cessation services based on Chinese medicine as well as Western medicine. The Hong Kong Council on Smoking and Health, meanwhile, focuses on mounting publicity campaigns targeting the community on quitting smoking. So over the years, this is the established and effective practice. Reverend Kuhn? So $86 million for the Tobacco Control and Alcohol Control Office. That's more than double that amount for COSH. TACO works in a different manner than COSH. TACO also takes forward law enforcement, so there should be sufficient manpower to conduct inspections and law enforcement action. You still have 1 minute. Next, Mr. Dominic Lee. I have a question on HHB 142. According to a reply, out of the 170,000 cases approved, conditional waivers were granted 86,000 cases. That's over half of them. For these applicants, they signed declarations in order to receive the certificates. They have not completed the means test. Now, for these on conditional waivers, some of them waivers will expire in the end of March. I mean, they had expired in the end of March. How many applicants submitted the relevant documentation before the deadline? And what about the others? Because according to you, if documents for proof are not submitted before the deadline, they'll be required to pay up. Now, there is a concern that this will become a time bomb if the waiver is not extended. The second point is about the effectiveness and the result of the fees and charges reform. Now, this reform has been put in place for 2 to 3 months. Can you tell us about the overall increase in income by the of the HA, for example, A&E department, inpatient services, other specialty services? Can you tell us whether there has been a drastic drop in the number of attendances because grassrooters may shun the service because of the increased cost? Now, for the fee waiver mechanism, the HA's resources are limited. They're valuable. Waivers are given to applicants who come with good reasons. They don't have means to pay for medical expenses, for example. Now, as you know, even after the reform, the government subsidizes up to 95% of medical spending of the public. The public also just pay 5%. As for the numbers that you've asked, as well as effectiveness, I'll give the floor to Dr. Libili. Thank you, Mr. Lee. We have not come across a case in which documents were not submitted at the lapse of 3 months. Members of the public submitted documents as requested. In fact, 220,000 cases of fee waiver applications were received up to the 31st of March. 130,000 of them came with all the documentation. For 90,000 cases, we're still waiting for the documents, and we've dished out conditional waivers. They should be able to complete the process in 2 months. Now, as for whether there is a drop in attendances, for example, in terms of medication to ease itchiness and relieve pain, in just 3 months, the amount dispensed dropped by 20%. And according to other studies and tests, for the examination services, they dropped by 10% as well. In terms of utilization of A&E departments and hospital beds, at the moment we don't see a big difference, except for non-urgent cases at the A&E. As for inpatient services, we have not observed a major drop. My question is on 021. This is a question on the development in Tung Chung. In Tung Chung, the population will increase by 110 to 120,000. The airport also receives 70 million visitors per year. Now, my question is on increasing manpower for Lantau, North Lantau Hospital, and also relevant facilities. But from the answer, I learned that first, there is no increase in number of hospital beds, and second, now it's not a general hospital. For many patients, if need be, they would need to go to Princess Margaret Hospital. But in fact, I've asked residents in Tung Chung, it takes 35 to 40 minutes to go from North Lantau Hospital to Princess Margaret Hospital. The third question is on whether there will be increase in manpower and resources. Now, you will keep the matter in view. I don't think this is appropriate answer you've given, because I ask about manpower and I don't think my question is answered. Secretary, I'll give the floor to Dr. Libili. When we plan for redevelopment of hospitals and addition of new facilities, we need to consider the clusters as a whole. We also need to consider cost effectiveness. Indeed, the population in Tung Chung is on the rise, but in terms of the rate of increase and the aging of population, the situation is not as worse as other areas such as Kowloon and in the new territories. Now, we need to allocate resources in an appropriate manner. We also note the public's need for services, especially primary care, and we're going to increase manpower in this regard. As for other serious cases, we focus our efforts in major hospitals. At the same time, we keep in view the population growth as well as other matters. For example, for service capacity in North Lantau Hospital, especially in the A&E department, these are usually Cat 4 and 5 cases that are not urgent. Now, in terms of service delivery, if adjustments are to be made, we will need to keep in view the situation and see whether the mode of service should be changed to one similar to Princess Margaret Hospital. Now, Chair, my question is very clear. If there is a need to adjust the service delivery, then in the coming 3 years at least you should tell us your manpower planning. There must be a plan. If you've identified the problem in the coming 3 years, you should be able to tell me how you're going to deploy manpower. But I'm not given this answer, and my concern is for Tung Chung residents, they don't get protection.
唔該，主席。
Dr. Lee, thank you. We need to take into account the demand before we make adjustments. PMH, there will be manpower adjustments made. Tung Chung, there are services provided to Kowloon West residents for such as CT, MRI. As for more serious cases, they will be diverted to the Kowloon West cluster. We will make even distribution of resources. The flexibility might decrease if we only take into account the clusters across Hong Kong. Professor Chen, thank you. I thank the administration for providing very detailed replies to my questions. I'd like to ask about traditional Chinese medicine. I'd like to follow up on HHB 048. It's about the Chinese Medicine Hospital, Hong Kong. I'm glad to see over 10,000 services have been provided in the first month of the opening. In 2026 to 27, the administration has reserved $101.4 billion on developing the Chinese Medicine Hospital of Hong Kong. I'd like to know in which aspects subsidized outpatient services are very well received. Does the administration have sufficient resources to respond to the popular demand? I'd also like to ask about HHB 054 and 206. In HHB 054, in 2025 to 26, $4.7 million regarding Hong Kong standards, about 50% decrease, and I'd like to know the reasons why. According to HHB 02-206, there seems to be a decrease in the number of PCM registration. In 2023 to 24, there were 100 to 200 applications. However, in 2024 to 25, the number decreased to 69 or 59 or so. I'd like to ask about the reasons for the decrease. Is it possible that the nutrition label is one of the reasons? I'm also concerned with medical expenditure. As the Secretary said in the opening remarks, in 2026 to 27, the estimated recurrent expenditure on healthcare is about $118.9 billion, accounting for 19.8% of recurrent government expenditure. With population aging in Hong Kong, there will be more and more resources. There will be more and more demands and expenditure in this regard. So I'd like to know what other measures the administration has to counter population aging in order to ensure the quality and sustainability of the local public healthcare system. There are a total of 4 questions. Let me start with the last one. In relation to public healthcare recurrent expenditure, with the population aging situation in Hong Kong, comparing with similar economies, we only account for 8.4% of the GDP, or rather 8.6%. This is rather on the low side. But with population aging on the horizon, there are a lot of things we need to do, including increasing the pricing transparency of the public healthcare sector, as well as the fees and charges reform. I'm not going to detail all these measures one by one. Regarding the operation of the Chinese Medicine Hospital of Hong Kong, there is a mechanism in place. This hospital isn't a public hospital of the HA, nor is it a private hospital. I'm going to ask my colleague, Dr. Zhang, to give you more information. Thank you. The Chinese Medicine Hospital of Hong Kong has seen an increase from 150 to 260, up by 70%. We are reviewing the demands and service capacity. We are discussing with the Chinese Medicine Hospital of Hong Kong increasing service capacities. At the end of this year, in the hospital, there will be inpatient services, so the second and the third tier services need to be enhanced as well. It will probably cover research and development as well as training. For other questions, please provide supplementary written replies. Thank you. Mr. Butang, thank you. I'd like to ask about two areas. One, rare diseases and genetic treatment, as well as Kowloon East cluster. 166 and 167 in relation to rare diseases. I thank the administration for showing care over SMA patients. This is music to their ears. For those above the age of 25, they can apply for the medication for SMA patients as well, so that they don't have to cross the boundary in order to seek treatment or medications. This is exactly how resources need to be pulled to help critical and serious patients. All right, I'd like to ask about 166. I attended a forum organized by a Rare Disease Alliance. They talked about genetic treatment. It is a tailor-made solution as well as an appropriate one. It is hoped through a genetic treatment, patients can be cured in one go. In 166, there is no specific figure on the expenditure on rare disease patients. You only talked about a lot of resources. You quoted the figures in 2023 regarding the Children's Hospital in Kai Tak. The city's first ever gene therapy in 2023 for a male infant suffering from SMA, that is spinal muscular atrophy. If we encourage the use of gene therapy, the overall effectiveness, including the financial effectiveness, cost effectiveness, might be better than months of expenditure on the same disease. Regarding HHB 076, about Kowloon East cluster, simply put, there are many hospitals all over Hong Kong providing A&E, but for UCH rather, it ranks second, whereas Queen Elizabeth Hospital ranking the first. The A&E is only 3,000 square feet. When will you expand it? Professor Low? Well, now I cannot make any assessment in relation to gene therapy. It is a rather new trend. It keeps developing. There are new methods, and the cost effectiveness, safety have uncertainties. Recently, there is a kind of gene therapy. It targets rare diseases as well. However, in the process during the clinical examination stage, some side effects have surfaced, so this has been called to a halt. We need to evaluate the cost effectiveness as well as safety of each gene therapy. We don't make any evaluation for all gene therapies in one go. The UCH is undergoing an expansion. I'm going to ask Dr. Lee to give you more information. Thank you. Thank you, Mr. Bill Tang, for the question. UCH does have a cramped space. I'm grateful to our colleagues over there. The expansion project should be completed within this year. We are expecting an increase in the floor area of the A&E or the hospital so that we can better respond to patients' need. I'd like to ask about 048 and another question. The administration asked about smart medicine, operational efficiency, and so on. An interdisciplinary committee will be set up in order to provide steer over the introduction of state-of-the-art pharmaceutical products and medical devices. The administration will also proactively contact medical device companies regarding surgeries using large robotics. Some products have been registered on the mainland, some with the hospital authority. In public hospitals, however, they are using overseas brands when it comes to surgery robots. I'd like to know whether the administration is encouraging locally researched and developed medical devices or equipment to be used in local public hospitals. Thank you. Recently, the speed at which they are imported has increased. There have been enhancements in this regard. These have resulted in a reduction in the costs. Dr. Lee, thank you. We want to bring some medical devices that have been registered overseas, and we want to introduce them into Hong Kong. We have room for collaborating with the industry so that we can introduce new technologies into Hong Kong, especially for those which have been proven effective clinically. We look forward to introducing these drugs and medical devices into Hong Kong. We also want to leverage the concept of an international healthcare innovation hub. We want these devices can be used in Hong Kong by the local healthcare workers. The HA is a rather large organization in Hong Kong. We are willing to partner up with local industry players on some clinical research so that we can analyze different equipment and devices. We can see whether these are indeed effective in Hong Kong. Thank you. I'd like to follow up, Professor Low, on the research, development, and use of drugs. We need to separate different roles. First of all, regarding R&D, we need colleagues in the HA to take part in the R&D of drugs. That is exactly how we can support the process. Regarding procurement, however, this is another area. We need to ensure that they have passed the relevant quality and safety tests. They need to be registered before they can be used in Hong Kong. But I have to emphasize that we need to ensure that there is cost effectiveness in the use of these drugs and medical devices. Just now you referred to robots. You need to make sure the use of these robots is safe. But does it mean that we buy as many robots as possible as long as they are locally manufactured? We need to take into account the number of surgeries needed in Hong Kong. In other words, we don't just buy locally manufactured research and developed medical devices just because they are locally manufactured. Thank you.
Next, Ms. Jovi Chen. My question is on 057. I'd like to follow up on this question about drug registration. Now, in part 3 of the reply, apart from applications under 1+ mechanism, the government also referred to some other figures. I understand that 19 applications have been approved. Well, perhaps at the end of last year it should be 14 instead. My question was on the number of cases possessing 2 CPPs. The next question is about 062. After the fees and charges reform in public health care, the HA has introduced a price hike. My question is on medical or drug expenses. Last year it was 12.7 billion, and this year it's 13 billion. So up by $300 million. I want to know whether the government is really able to save up, because in 2024 the HA said that upon its review and assessment, it would actively negotiate prices with the pharmaceutical companies. So I'd like to have more details. To answer the second question, with increase in healthcare needs and the use of new and innovative drugs, and if we use new drugs, definitely medical expenses will go up. So cutting down on spendings on drugs is not something we can achieve in the short term, as we want to provide the most advanced drugs to members of the public. So for this question, I'll give the floor to Dr. Libby Lee about registration of new drugs. Dr. Ronald Lam will take it. Dr. Lee. Thank you. Now, on drug expenses, definitely the amount will go up because of increase in service capacity, aging population, and increase in number of patients. So even for the same amount or same price of drugs, because of increase in service capacity, this expenditure will continue to go up. Not to mention the fact that we add new drugs to the drug formulary every year, and these are rather expensive drugs. Their patent period may not have expired. So despite exercising cost control, it is inevitable that expenditure will go up. As for our review, we consider the efficacy of the medication and see whether in the long run overall healthcare expenditure will come down as a result of taking this new drug by a patient. Say, for a type of blood pressure pills, it may help slow down the chronic kidney failure situation. So despite the initial cost being high, we may use the new drug. For the 19 applications approved under the 1+ mechanism, at the time of application, only 1 CPP will be issued. But sometimes the applicant might file an application the second time within the time frame, and sometimes there would be 2 CPPs. So at the time of application, we do accept 1 CPP. Only that the country of origin should be specified. Now, for the 19 applications, some of them managed to launch their product to other markets after getting approval in Hong Kong. They account for about half of all the applications. That means they are allowed to use 2 CPPs. In 2025, 60 cases of new drug registrations were approved in Hong Kong. I want to clarify, Chairman, does it mean that over half of these drugs got only 1 certificate at the time of application, but by the time that you approve the application, they've obtained 2 CPPs? Now, at the time of application, they are required to submit one CPP because there should be at least one submitted or issued by the country of origin. For the 19 applications approved, over half of them have eventually obtained more than one CPP. So that means they have one from Hong Kong because at the time of application they've already submitted one certificate. So after the approval, over half of the 19 drugs also got certificates from other places. So please follow up on the matter later, Ms. Chen. Mr. Perry Yu, I have two questions, one on HHB 208 and the other 254. Now, I am very supportive of the tobacco control strategy. However, there is an impact on tourists. According to the reply to Dr. Chen Kwong, in 2025, 10,357 fixed penalty tickets were issued, and the number of inspections increased by 25%. For the fixed penalty amounts, the fines reduced by 23%. I'd like to know whether you have a specific breakdown for the number of visiting offenders. As for HHB 254, according to the administration's reply, after introducing the new smoking ban on the 30th of April 2022, 3,929 visitors were intercepted at the border checkpoints. That means all of them were visitors. I'd like to know whether you have the breakdown between the overseas visitors as well as mainland visitors. And my question is this: visitors should not be held accountable because they do not know about the law. They may not know very well about the e-cigarette policies and our policy on alternative smoking products here. So at the time of entering Hong Kong, if they are ignorant, can we allow this mechanism to be put in place? And that is for them to surrender these contrabands at the BCPs. Well, I think this is a policy question, Secretary. About fines for smoking, especially at the BCPs, I'll give the floor to Dr. Ronald Lam. Now, we act either on complaints or we conduct inspections, and if we find an offender smoking in the non-smoking area, we take the same approach, and that is we take law enforcement action. On fixed penalties, we do not have a breakdown of visitor vis-a-vis non-visitors. However, we appreciate members' concerns, and that is whether visitors will be inadvertently caught by the law. So on this front, we will step up publicity. Apart from the usual multimedia channels, we also make use of the social media platforms of the mainland to publicize our smoking ban rules and also non-smoking areas. Especially at the BCPs, the TACO also displays posters at conspicuous places. We also have infographics, and we work with the tourism sector. We dish out the infographics to visitors with their help. About the tobacco control legislation, I'd say that it was enacted 10 years ago. The law enforcement situation has been quite satisfactory. In recent years, we have ASPs and other ban on ASPs, as well as expanding the non-smoking areas, banning people from smoking whilst queuing up and waiting at the entrance of public places, etc. Law enforcement remains smooth upon introduction of the new measures, and we also give equal treatment to all offenders. We mount education and publicity in order to exercise tobacco control. But please follow up on the matter later. Next, Mr. Chang Pui-kong. I'm concerned that some vendors sell alcoholic beverages to minors. So I'd like to follow up on my question, and that is reply number 213. According to your reply, in 2022-23 to 25, the office received altogether 76 cases of selling liquor or intoxicating beverages to minors or supplying them with the same. In the course of business, you conducted inspections and investigation, and no contravention was identified. And then 76 cases in 3 years. 76 complaints in 3 years to no avail. I'm concerned about your complaint mechanism, and it doesn't seem to be effective. Can you explain to us how investigation was carried out? Why is it that none of the 76 complaints was substantiated? And in part 3 and 4 of your reply, in 2023 to 2025, TACO conducted over 1,500 cyber patrols and issued over 340 advisory letters. Most of these website operators were cooperative upon receiving the advisory letters. So what would you do if some operators are not cooperative? Will there be any follow-up action? So, Mr. Chair, are you concerned about the money spent as per the reply here and the less than effective result? Secretary, thank you. Now, your question, I'll answer the question about liquor, about selling liquor to minors. The complainant should be a third party. The buyer or the seller will not lodge the complaint themselves. So for Department of Health, unless they carry out an undercover operation, then nothing will be discovered because the vendor and the buyer are both willing parties. They will not initiate this complaint. So about cyber patrols, I'll give the floor to Dr. Lam. TACO enforces the Dutiable Commodities Ordinance. They work in 2 prongs. First, any person who distributes, sells, or supplies liquor to those below the age of 18 in course of business commits an offense. The second prong is about remote distribution. That means through online channels. Now, we should not just look at the number of arrests when it comes to law enforcement. We need to ensure that the law enforcement process is fair and just. So let me cite some figures. In 2025, when it comes to person-to-person distribution, so to speak, we conducted over 3,000 inspections. This year, in 2025, actually, 2 summonses were issued as to whether we could further pursue prosecution after issuing the summonses. We need to seek advice from the Department of Justice. As for remote distribution, in 2025, we conducted over 500 such inspections with 123 letters issued. Now, we also need to consider policy-wise whether we should initiate prosecution. For remote distribution, we need to check, for example, whether there is a specified notice. And that is, we require the buyer to declare that they are above the age of 18. So that depends on the circumstances in issuing the advisory letters. So despite the large number of inspections, the cases result in summonses or just warnings.
Mr. Chen Pok-chi, thank you. I'd like to follow up on HHB 007. That is about the scheme. On the 31st of March 2026, the government made an announcement. Over 60% of the people who received assistance. I'd like to know the breakdown of the amount of subsidies. Thank you. The scheme was an extension, that is, the Elderly Healthcare Voucher GBA pilot scheme. Some patients live on the Chinese mainland for a long time. It overlaps the Elderly Healthcare Voucher GBA pilot scheme. However, elderly healthcare vouchers are for elderly residents in Hong Kong. Whereas for the one about follow-up, that is the pilot scheme for supporting patients of Hospital Authority in Guangdong, Hong Kong, Macau GBA, covering 9 hospitals. Patients need to pay a copayment amount of $100, whereas the remaining amount will be subsidized by the government. Right now, I don't have detailed information about how much will be paid by patients. We don't know the amount of money paid by patients. We only know the subsidy amount shared by the administration. Patients only need to pay $100 at the Hong Kong Shenzhen Hospital, whereas the remaining amount will be paid by the government, and the cap every year is $2,000. The average patients need to pay at Hong Kong Shenzhen Hospital is about $300. $300 over $2,000, that's about 6 times of attendances. Thank you. Ms. Kwok Foo-yung. Thank you, Chairman. I'd like to follow up on my own questions. HHB 225 and 226. It's about elderly healthcare centers integrated into the district health network. There's a block vote responsible for this, so details cannot be provided in relation to the breakdown. However, at the district level, many elderly people say that they find elderly health centers very good, but they aren't aware of the fact that these are actually available in their areas. So I'd like to ask, if elderly people do not know that there are such centers in their own districts, no matter how many resources we have, we cannot solve the problem. So I'd like to know how publicity can be enhanced in order to promote to elderly patients or elderly people in Hong Kong that there are indeed such centers in their districts. HHB 226. About child assessment service, the provision for 2026 to 27 is up by 4.8%, whereas the number of people remains the same. There are difficulties when it comes to manpower recruitment. Before the age of 6, it is the prime intervention period for SEN children. The earlier you intervene, the better. So I'd like to know, against the backdrop of a manpower crunch, how are you going to alleviate the manpower shortage? Will the government consider working with tertiary institutions to train talent in order to solve the manpower crunch? Thank you. Regarding district health centers, DHCs don't just serve elderly people. we provide holistic support. We want to use district health centers as a hub. Regarding the integration the integration of the elderly health centers into the district health network, I'd like to ask Dr. Pang to give you more information. Thank you, Chairman. As for elderly medical services, we know the demand has been significant. We have elderly health centers of the HA. We know services could be expanded and extended. We have been in talks with the HA in relation to reducing duplication as well as increasing service capacity. We will also be working with the family outpatient clinic of the HA. We hope that there will be a unified process to help improve the overall physical conditions of elderly people in Hong Kong. Regarding child assessment services, we are consolidating our resources. The resources will be switched from the DH to the Children's Hospital in Hong Kong. I'd like to see if Dr. Lee has anything to add. Dr. Lee, we are going to provide these services in DHA. We have sufficient pediatricians in DHA. So we hope to shorten the wait, and we also want to provide more sessions to shorten the wait. Next, Mr. Tam Chun Kwok. Thank you. I'd like to follow up on HHB 164 and 165. These are my own questions. In the replies provided by the administration, it is said that the second hospital development plan will be reviewed and published in an orderly manner. Will they be announced this year or next year? There will be a manpower projections when it comes to the Northern Metropolis development. Many new public housing and HOS flats are involved. The administration said the NTN cluster will be added when the time comes. Around what time? After the population intake in the NTN, we need to make sure there will be sufficient medical services provided to residents in that area. I'd like to ask about HHB 173. In the second quarter, 25,000 evening consultation slots will be added gradually. At the district level, we have seen an increasing demand in evening consultation slots, so I'd like to know whether 25,000 slots are sufficient. Is it possible to increase the number of slots further in the evening? Thank you. Regarding hospital development plan, we have already explained in the past few years there have been significant changes to the population in Hong Kong. Our last development plan was based on figures in the past. However, with the Northern Metropolis development as well as the changes to the population structure in Hong Kong, we need to plan afresh. Looking ahead, we are not going to use 10 years as the basis. It's just too long. In addition, we may not formulate a plan based on the entire Hong Kong. We need to break down Hong Kong into smaller units. Regarding the development of the Northern Metropolis, when will we make announcements? We believe the provision of public healthcare services go hand in hand with the development of the Northern Metropolis. We need to tie in with the population intake in that area. regarding evening consultation slots. We take into account the local population as well as the relevant data. We need to decide in which areas we are going to provide more evening consultation slots alongside manpower arrangements. In a few districts, we have already designated them as our key areas. I'd like to ask Dr. Pang to give you more information in relation to more evening consultation slots in some districts. Dr. Pang, Tuen Mun, the North District, Tai Po. We're going to provide more slots for the public. We do so in a flexible manner. We take into account data to make adjustments. Mr. Lau Ka-keung. Thank you, Chairman. I'd like to follow up on my own questions. HHB 132. It is mentioned that guidelines are being drawn up. I'd like to know whether analyses will be conducted in relation to the procurement of drugs and medical devices. It is also mentioned that the Institute for Medical Advancement and Clinical Excellence brings together different areas of expertise to formulate standards. I'd like to know the progress. Thank you. We use the evidence-based clinical guidelines. In other words, we take into account the type of disease and draw up the standard in order to enhance quality. At present, the HA has formulated some standards. Through the IMACE, we wish to expand the coverage so that members of the public across Hong Kong will have a standard to follow. In the case of some medical blunders, the IMACE can publish standard guidelines, and that will become the basis regarding the different diseases you mentioned, such as percutaneous coronary intervention, regarding the cost of introduction. It depends on the individual service providers, including the HA or private doctors. The IMACE takes into account the perspective of healthcare. They consider the medical treatment instead of the cost. The cost even is not the most important concern of the IMACE. In Hong Kong, we adopt a dual-track approach that is covering the private and public healthcare systems. Regarding the synergized development between these two areas, we need to make sure the development of the private sector will not impact on the public one, not least the manpower supply. If for some specific areas in the private healthcare sector, if the development is moving very quickly, this will affect the services provided by the public healthcare sector. Mr. Hong Kam-in, thank you. I'd like to ask about mental health. HHB 090 and 093. These questions are about mental health. At present, there are a total of 333,500 people attending follow-up. For those above the age of 18, about 279,000 people. The waiting time is about 70 weeks. As for adults, the time is about 25 weeks. I'd like to know why these two waiting times are so different. The former is for adolescents, whereas the latter for adults. The difference is indeed too great. Prevention is always better than cure. At present, $7.2 billion is spent on mental health. I'd like to know whether the government has any measures on mental health education as well as prevention. As for the number of psychiatric doctors in Hong Kong, they are under great pressure. Regarding PPP, private-public partnership, how is the waiting time being reduced? Thank you.
Secretary. Now, we always emphasize prevention when it comes to mental health. It's not, however, only related to health care. At many levels, we rely on the whole community to ensure mental health. For example, we are joined by the Education Bureau to work on the education front and Social and Welfare, the Labor and Welfare Bureau on welfare aspects. At the workplace and schools, even families, we need support from all sides, as these would affect mental well-being as well. So it's not a purely medical issue. As for mental patients and the waiting time at HA, I will give the floor to Dr. Libby Lee. Thank you, Secretary. Thank you, Chair, and thank you, Mr. Hong. As for child and adolescent psychiatric SOP cases, the waiting time is different from that for adults. Because of the nature of the mental issues, it may take a longer time for adolescents and children to be diagnosed with mental issue. They are not as expressive and they may not be able to communicate well with adults other than those outside their families. For adults, the waiting time is usually comparatively shorter because adults are in a better position to express themselves. And we also have a dedicated team in the Department of Psychiatry handling children and adolescent cases, and we will progressively increase manpower to shorten the waiting time. Now, about public-private partnership, as Mr. Hong mentioned. Now, we introduced some PPPs before, some with success and some not so, and we'll further explore collaboration and partnership schemes at a deeper and higher level. And we also introduced pilots to see whether through the help of NGOs we'll be able to shorten the waiting time for children and adolescents. Mr. Johnny Ng, I'd like to follow up on my question that is HXB 040 or 240 about tobacco control. According to Table 2 in 2026-27, $143 million have been set aside for law enforcement. That's down by 16% comparing to the previous year. And for education, the funding has been cut by just 1%. So I'd like to know why there's been a drastic decrease. At the end of this month, by the 30th of April, a new offense will be created, and that there'll be law enforcement action against any person in possession of an ASP in a public place. So, with a cut in the budget, will there be difficulties in law enforcement? And there may be disputes arising from the enforcement action, as if somebody is seen holding an ASP, they will be arrested. So will you consider relying on technology like the police to mount enforcement action? Dr. Lam, like the member said, well, we need to maintain the same level of law enforcement whilst keeping costs at bay. We are leveraging on technology. For example, when it comes to fixed penalty notices, we rely on back office operations in the past, such as putting entries into computer systems. Now, with technology, at the time of issuing the ticket, data would be automatically transmitted to the terminals for record and for follow-up. And one way, that way we can enhance enforcement efficiency. We also have body-worn video cameras. If need be, they would be used as well. And in the near future, we're going to launch new tobacco control measures. But first and foremost, it is important to mount publicity and public education. We need to raise the public awareness on our mode of enforcement, on, say, the expanded non-smoking areas and the possession of ASPs. We will continue to publicize the new rules to the public. And the second part of the answer is this. After years of experience, when our law enforcement officers have intercepted somebody suspicious, we will consider the circumstances. For example, after the new ban on ASPs is put in place, we will check and see if the person is in possession of the cartridge. If it's a contraband, then we will proceed. And we'll also enhance communication. Tobacco and Alcohol Control Office is very grateful for the police's assistance, because on a regular basis, training is provided by the police for our inspectors to enhance their enforcement efforts. Ms. Grace Chan, I'd like to follow up on part 2 of the reply, number HHB 031, and that is about psychiatrists, psychiatric nurses, and allied health professionals under HA and the establishment for medical social worker and allied health professionals. According to the information over the past 5 years, the number has increased by just 3 comparing to the establishment in other specialties. This is on the low side, so I'd like to know the rationale behind. Who will take this question, please? Dr. Libby Lee. Thank you, Chair. Thank you, Ms. Chan. The Social Welfare Department is responsible for medical social workers. So when it comes to manpower deployment, we need to refer to their practices, but at the same time, we do tell them our demands for psychiatric services. So for this question on medical social workers, you should direct that to the Social Welfare Department. Next, Mr. Chong Ho Fung. My question is on HHB 012. According to the administration, the estimated expenditure for the vaccination subsidy program in 2025-26 is $270 million. Now, for shingles, I understand that vaccine jabs are available in the market, but the vaccination rate remains low. But there are those who are high-risk individuals, such as those suffering from arthritis or cardiovascular diseases, and they are hugely affected. Without vaccines, the time needed for treatment and the efficacy may be affected. And in fact, we've conducted a questionnaire survey. They will be willing to take up a co-payment approach if subsidies are provided by the government. So will the government consider allocating resources and adopt a co-payment model for the immunocompromised patients. That involved about 7,000 people. My next question is a follow-up on 073. It is said that the government continues to conduct a review on the Samaritan Fund as well as assistance items under the CCF. There is now a rare disease called PAH. The patient group have written to us. Last year, the government in Hong Kong, a new drug was introduced, and subcutaneous injection for a patient is only required once every 3 weeks, and it also tackles the disease at source. However, this drug has not been incorporated in the safety net. I hope the government will consider including this drug in the safety net to treat this rare disease called PAH. Secretary, regarding vaccines, we have this scientific committee on vaccination for preventable diseases, and the government considers their recommendations in deciding on the vaccines to be subsidized and the target groups. Now, we also consider whether, for example, this is a communicable disease, the impact on the whole community as well as the healthcare system. The member mentioned this jab for shingles. Now, this is not actually a communicable disease. Rather, is a disease that attacks an individual's own immune system. The virus hides in the body of that individual, so to speak, and when the immune level of this patient is low, this disease will be triggered. So it's not an infectious disease. We need to consider a number of factors, including the efficacy of the vaccine jabs and whether there are other ways of treating the disease, as well as the severity. The scientific committee conducts assessment on these matters, and we also review the impact of this disease to Hong Kong as a whole. Now, about the PAH, the disease you mentioned is a rare disease. Other members have also referred to new drugs coming on stream treating serious illnesses. As I set out in the fees and charges reform, we want to be able to reallocate resources under this co-payment model so that more help can be provided to those suffering from major and critical illnesses. But I don't think this is a discussion for this council. Rather, we should rely on our experts. They will consider all the objective data. We should not be emotional and be subjective or biased. Rather, we should rely on experts in analyzing the data. Next, Mr. Kingsley Wong. HHB 248 and 174. These are the two questions I'd like to ask. Now, this is a policy that can help our elderly people receive dental services. There are 5 recognized medical institutions in Shenzhen, one having 22,870. That's over 80%. And that's a major gap comparing to other institutions. Have you considered why? Has it to do with the location? So that's a question on overconcentration. The other question is about training courses for nurses. In 2025, there are 9,805 subsidized places and 2,412 non-subsidized places. According to the Healthcare Manpower Projection 2023, by 2030-2035, the manpower level projected will see a difference of 8,700 and 6,900. Will there be a surplus of manpower, especially in relation to subsidized courses and non-subsidized ones? Will there be an adjustment? Because upon completing these courses, these candidates may find that there is a surplus.
Thank you. For healthcare vouchers, it is for members of the public to decide. The government doesn't require anyone to visit a particular healthcare organization. Regarding the organization in Luowu Shenzhen boundary control point, there are a wide range of factors affecting the use of the services. One obvious factor is that the organization is close to the boundary control point. This organization isn't just for Hong Kong people living in the GBA. Actually, many Hong Kong people living in Hong Kong also opt to use the services provided by this organization. And of course, there is a demand in these services. That's why it is quite popular among the people in Hong Kong. We don't have any intention as to reduce the number of services or require patients to visit a particular medical organizations. Vouchers are benefits provided by the administration to people in Hong Kong. It is for members of the public to choose for themselves. As I said in the opening remarks, there is still a shortfall of nurses in Hong Kong, about 3,500. That is 10%. We need a lot more nurses to join the industry to provide services. As many as 90% of the public are using public healthcare sector services. When nursing students graduate, they may not choose to become a nurse upon graduation. Some nursing students may choose to take up different jobs upon graduation. This is quite different from doctor students. It seems a great shame when a medical student doesn't become a doctor upon graduation, but the situation is not the same for nurses. What we need to consider is that we are still seeing a shortfall of nurses in the public healthcare sector. Regarding how we can attract nursing students to become a nurse upon graduation, especially for those who have received subsidies from the government in order to protect the health of the public, we have already pondered over this question, and this is indeed what we need to consider. Next, Mr. Peter Shield. Thank you. I'd like to ask about HHB 244, about tobacco control and tobacco. Regarding patrols in 2024, 30,000, and in 2025, about 35,000. Regarding fixed penalty notices in 2024, 13,400 or so, whereas the number decreased to 10,357 in 2025. There was a decrease in the number of FPNs. I'd like to know why there were more inspections, whereas there were fewer FPNs. Just now, Dr. Johnny Ng mentioned the work of TACO, 100 million or so, down by 10% or so. On the 30th of April, ASPs and e-cigarettes will not be legal anymore. There is a proliferation of illegal or illicit cigarettes in the market. The Secretary said that 9.1% to 8.5%, that is the latest smoking prevalence rate. The Secretary said that he didn't quite understand. Well, from 9.1% to 8.5%, the smoking population has dropped by about 6 to 7%, whereas for the tax revenue for tobacco, that is tobacco duty in 2023, $7 billion or so. The end result we will get is $12.5 billion. However, for tobacco duty at that year, just $5.5 billion. So we have lost $7 billion. Just now, the secretary said that it was due to the pandemic. That's why I'm going to quote the figure in 2017, about $6 billion plus $31 twice, and then the duty will double to $11 billion. Just a decrease of about 6% of smokers, but then the tobacco duty was halved. You're still going to cut budget. So how are we going to regulate illicit cigarettes? In addition to the police and the CNED enforcement efforts, there are still online promotions about illicit cigarettes. So how can we deal with it? Secretary, well, Mr. Petershu's question has been answered a lot of times. Tobacco duty is subject to a lot of different factors. In addition to the overall decrease in the smoking prevalence rate, the number of cigarettes smoked by smokers has seen a decrease as well. We shouldn't use the figures in the middle of the pandemic to draw comparisons. Let's take the figures in 2019. As for the number of sticks of cigarettes, it has dropped by 30%. That is, in addition to a drop in the smoking prevalence rate in just 2 years, the average daily number of cigarettes has dropped by about 10%. So, decreased in the total number of smokers and the total number of cigarettes smoked. This has led to a decrease of 30% of the overall consumption of cigarettes. Comparing with the pre-pandemic level, members of the public have chosen to go north, and many more people have chosen so. We need to add this factor to our analyses. Of course, combating illicit cigarettes is our main focus, and we will use the label scheme as the main focus. Well, Secretary, do you think that the issue of illicit cigarettes is not serious in Hong Kong? Well, we do have this issue in Hong Kong. The CNED and other government departments are doing their level best to combat it. The duty paid label is actually a very important measure for tackling the issue of illicit cigarettes. Thank you. Mr. Eric Yim. Thank you. I'd like to follow up on HHB 186. It's about the newly commissioned Chinese Medicine Hospital of Hong Kong. Regarding the subsidies provided to the CMHHK, I'd like to know the future trends. $101.4 million have been set aside for the CMHHK. 35% of services are covered by the CMHHK, and this figure is expected to increase. And there will also be more high-end protections offered to patients. So regarding the amount of $101.4 million, I'd like to ask about the possibility of making ends meet with the by the CMHHK in the first year. Will the amount of subsidies decrease? The financial model and the operation model of the CMHHK is different from the public hospitals or private hospitals. It is neither a private hospital nor a public hospital. It runs on the hybrid mode. I'd like to ask my colleague to give you more information. The CMHHK is responsible for providing services as well as training, research and development, and so on. In 2026 to 27, in this period of time, it has started to provide services in phases. It's in the third month of service commencement. When it enters the third, fourth, or the fifth year of service, there will be more and more services provided by the hospital. The total number of beds will total 400, and it will also serve over 400,000 patients every year. In 2026 to 27, the amount of $100 million is the financial commitment based on the existing scale. There will be training R&D starting soon. That's why government financial provisions will increase every year. But of course, we need to take into account service demand and the demand of the public. Government subsidies, market-oriented income. What matters is that the CMHHK needs to fulfill the responsibility given by the government. It needs to provide medical services alongside R&D and training responsibilities. In this regard, we will monitor the overall financial arrangements in order to make sure that the hospital will fulfill its mission. Mr. Alan Chen. Thank you, Chairman. I'd like to follow up on my own question. HHB 003 is about Chinese medicine treatment. The treatment received by CM professionals. Will the administration take this opportunity to review the career ladder and the remuneration of Chinese medicine practitioners in order to narrow the gap between Western and Chinese medicine practitioners? They also need to attract more students to join the industry. At present, we don't have any separate structure for the remuneration offered to Chinese medicine practitioners. Most traditional Chinese medicine practitioners are providing services in TCM clinics in society. It is the market that is deciding their income. As for the 18 district Chinese medicine clinics cum training and research centers, they will decide on the remuneration of TCM practitioners. The services provided by Western medicine practitioners and TCM practitioners are different. So are the systems and the mechanisms. That's why we shouldn't directly compare the remuneration of TCM practitioners and Western medicine practitioners. Regarding the remuneration of TCM practitioners in the Chinese Medicine Hospital of Hong Kong, comparisons have been drawn from the Chinese medicine clinics cum training and research centers in 18 districts. The purpose is for the recruitment of TCM practitioners, the remuneration needs to be competitive. Without doubt, we need to provide competitive remuneration packages to TCM practitioners. I can ask Dr. Zheng to give you more information regarding setting the remuneration of TCM practitioners. The Chinese Medicine Hospital of Hong Kong fulfills the important responsibility of developing TCM in Hong Kong. We need to work with different organizations or bodies to jointly develop Chinese medicine. The Chinese Medicine Hospital of Hong Kong provides second and third tiers of services as well as inpatient services. That's why we do need talent to provide these services. In determining the remuneration of practitioners, we need to consider the professional development of the hospital as well as that of the practitioners. That's exactly how we can attract talent to join the industry. We will also monitor the situation in the market. We need to see whether we can recruit sufficient talent, and we will review the remuneration offered to TCM practitioners. Thank you.
Next, Mr. Michael Lee. I have questions on dental services. 218, 217, and 145. Now, the government places emphasis on dental care because dental problems could lead to major problems. We have an aging population. In Hong Kong, dental care is provided by the private sector, and the services are quite costly. About vacancies set out in 145. How does the government replenish the workforce in your system so as to provide services to the public? The second point is about the various support schemes such as community dental support scheme and also outreach services for elderly and services for children. Now, many people in Hong Kong now go up north for dental care in the Greater Bay Area. In a way, this lifts pressure off the system. Can we provide vouchers for members of the public to use dental services in designated institutions or clinics in the Greater Bay Area so that elderly people don't need to queue up for dental services in Hong Kong? Secretary, first, for healthcare vouchers. Now, it's for the elderly people to decide where they'd like to receive the service. We have expanded the coverage of the pilot scheme in the Greater Bay Area. And for those living in the Greater Bay Area after retirement, they can still use the vouchers in designated institutions in the Greater Bay Area. But in fact, the utilization rate in the Greater Bay Area accounts for only 3% of the total sum. So we're talking about a minority here. Still, this pilot scheme helps elderly people who live in the Greater Bay Area to receive dental services more conveniently. Now, the Department of Health provides dental services. We're short of dental care professionals, but we've continued to strengthen our efforts. For example, we provide step-up training for locals, and we also have a dedicated scheme for non-locally trained professionals. However, I want to emphasize that the Department of Health provides specialized services. The department treats not just toothaches, but other problems. As for other dental care issues in general, we still rely on dentists in the private sector to provide services. Now, I will give the floor to Director Dr. Lam to say more on vacancies. Now, for vacancies in the dental officer grade in the past 2 years, the vacancy rate ranged from 22 to 29%. But we see an improvement, especially after amendments to the Dentist Registration Ordinance. There are two ways of introducing non-locally trained dentists, that is through limited registration and special registration. Now, through our global recruitment efforts, at least 11 dentists have joined through the two avenues I mentioned. And we also have year-round recruitment efforts. In fact, upon legislative amendments, we've introduced an internship arrangement. Over 90% of interns this year have actually applied with us. In the next recruitment exercise, we do hope that we'll be able to recruit them. Over 90% of interns have filed their applications. Now, for those with special needs in the community and those having financial hardship, we do provide help. Not only by providing services under the Department of Health, we have other schemes. For example, for those in residential care homes or daycare centers, we have outreach services. We also have community schemes. We collaborate with NGOs. And we also mount monitoring, and we provide subsidies to cover those in need. Well, we're now at 10:49. We're supposed to adjourn this session by 10:50. Now, as I said at the beginning of the meeting with Dr. Junius Ho and Ms. Rebecca Chen, please continue to follow up on their questions by the use of this standard form, which should be submitted by 7 o'clock to the Secretariat. That ends the session here. The next session starts at 11.